Hi friends, welcome back to NHSRN. Today we are going to discuss what are the main changes after COVID-19. The first thing is I would say it's lot more easier than before. So the only one thing you have to do at home, be prepare well and always confident. Okay. So the first main changes is you have to use mask throughout the exam and throughout in the exam center as well. So 2 to 4 hours. So whenever you are practicing at home, use the mask, so that won't be a hinder when you are at exam center. Okay. So one assessment, you have to verbalize each and every things when you are at Osce station, like how are you going to do the blood pressure, how you going to check pulse rate, how you going to check respiration. Okay, so you have to explain very well. Okay, that's a 12 minutes assessment station. Then examiner will give you a sheet with all the numbers, like for example blood pressure is this and heart rate is this and SpO2 is this. So you have to document correctly. Okay, that's one of the difficult task in assessment. So please practice at home when you do the how to do the recording, and use 1, use 2 charts. Record it properly. In case if you made a mistake, you can put error, date and sign, the protocol. Or maybe you can ask the examiner for the another sheet. It's all depend upon the examiner. So if you made an error, you can try to ask the examiner that can I get another sheet. If not, put error, sign, date. Okay, errors can happen. So especially in the exam situation, you will be blank out. So careful. Just relax, take a deep breath and enjoy your exam. Okay, so this is 12 minutes exam usually. So whenever you practice, at least finish in 10 minutes. That 12 minutes, it's enough. Okay, because you won't get any real patient, you get mannequin. So you just show how you're going to do and verbalize. The next station is planning. That is 15 minutes, still 15 minutes. You still need to use your mask in 15 minutes. There is no much changes in planning station. Then implementation is same. You have to use your mask and the same procedure. What are the things you used to do? Usually we get 6 to 8 medication in the medication chart, but you just need to keep 2 to 4 medication maximum. So please be aware on the traps there. Okay, I have already explained what are the traps. Like if the patient asks you pain medication, you have to follow five rights: right time, right dose, kind of thing. Sometimes patient had the paracetamol or pain medication an hour before and they still asking you pain medication, then you have to think about it, what you have to do. Okay, so before you give medication, you make sure that the right time. Okay, if it is 1 hour before, don't give it, and explain to the patient why the reason you can't give you, and you can always reassure the patient that what the steps you're going to do. Okay, the next one is you have to think about allergic reaction. If the patient is allergic, you can't give the medication, and always ask the patient. If the patient say allergic, you have to check the patient has red wristband. If not, verbalize, you will change it to the red wristband, and ask the patient what exactly happened when you had that tablets. Then you have to make sure that it is recorded in the drug chart. If not, you can always record it in there. Okay, then before you write codes, verbalize what code you're going to put. Okay, what is the next is evaluation. Evaluation stage is same like 15 minutes. You still use mask, so same like writing section, 15 minutes station. Okay, then skill stations, now it's 10 to 15 minutes. I think ANTT dressing is 15 minutes, rest of everything is 12 to 15 minutes. So try to finish everything in 12 minutes. Okay, sometimes they would say all the ID checks has been done, you can go straight to the procedure. It's all depend upon the examiner. If sometimes examiners say that you can save a lot of time to 3-way checks, allergic checks and everything, you can save the time for that. IM injection, subcutaneous injection is 12 minutes. The new thing is you have one room for your all the station. The examiner will be same. Used to be different examiners for different station, but nowadays only one examiner, means examiner, the same examiner throughout your Osce exam and in a same room. That's the quite interesting part. But one thing is, every exam finish, you have to wait 2 to 5 minutes outside. Then examiner will arrange everything for the next station. Then that's the way it's going to happen. So you will get more idea from your own university. For example, if you're booking Oxford, you can search in Moodle. They would explain everything about the exam criteria, exam scenarios and everything. They have updated there. Whereas if you are booking in University of Northampton, you will see in all details in Niles. When you book an exam, you will get a link from the university, so just go through it. Okay, then if you're booking your Osce in Ulster University, then you will see everything in Blackboard Learn. Okay, 3 universities. Just book one university and go through everything through their website. Then you will learn everything. So if you have any doubts, let me know.